Dr. Potter revolutionized the way that we look at musculoskeletal imaging.
She is absolutely collaborative and visionary.
She has an uncanny insight into the clinical relevance of the imaging. She'll not only help you make the diagnosis of it, she can tell you how to treat it. She's usually right.
When she started here, MR imaging was really in its infancy. We had 1, maybe 2 units, and now we have over 20 units throughout the organization.
Working with scientists, PhDs, and others in her department, she has truly developed the application of MRI.
She has established and run a very rigorous research program. She has a lot of expertise in quantitative imaging of cartilage, as well as MRI for imaging orthopedic implants.
She has multiple federal R01 NIH grants that are very, very difficult to come by.
What Dr. Potter did was push the envelope on every part of musculoskeletal imaging. So there's not one joint that we image that doesn't have several papers by Dr. Potter.
She ran this MRI conference weekly for many, many, many years, teaching in-depth understanding of how imaging informs diagnosis and treatment. She's really unique in that way.
She's not out of ideas, very much into her laboratory. She still loves teaching.
It's not just the patients and the doctors that benefit from Dr. Potter's knowledge base, but it's all of the field of orthopedics and the industry that supports the imaging techniques that we currently use.
The most consequential meeting I ever had with somebody outside of GE was my first meeting with Hollis. I had just joined GE Healthcare, and I was asking the team, how do the customers feel? How are we doing? Is everything okay? My team is like, yes, everything's fine. And she comes in and just lays in a number of ways that we could be better, let me put it that way. It was extremely constructive. She just really created this dynamic of, I need you to be great, partly for GE's sake, but really for the people we're serving. Together, I can help you develop technology. I can help you understand the problems I'm having. It really changed the way we ran the healthcare business, the way I thought about the business. That duality of intensity and excellence and high expectations, but for a noble cause. Not many people get to have a career that sounds like that, and she certainly has.
At her very core, she is just a wonderful, loving, and compassionate person.
So it speaks to what is one of a really good doctor's true characteristics, and that's humanity and empathy.
Andrew's a boy with a big heart. He was playing soccer. 2 people came in and his knee got twisted. We thought it was just a ligament. He told he probably wouldn't play in sports again. There are no words other than to say devastated at the time, but determined. And the first person I'm going to speak to is Dr. Potter. She could not have been more compassionate and wise in how she counseled me and told me that there was hope. Dr. Scott Rodeo operated on him for the first time, and his knee was as good as it's ever been. He became captain of his soccer team. They won the New England Championships, which could not have happened without Dr. Potter. And it wasn't just that she spent time with her expertise. She cared, followed up, offered to help in any way she could. These are qualities and traits that I wished more people had.
I don't think that there is any musculoskeletal radiologist in the world who is as accomplished in so many different fields.
Dr. Potter has carried the reputation of HSS around the world.
The work that Dr. Potter's done at HSS is one of the primary reasons we've been able to stay at the top. My hope for her is that she continues to innovate, continues to do research, continues to share all the vast knowledge that she's accumulated over the years, and passes on that knowledge to our future leaders in orthopedics.